One nursing-related error that stood out would be the most is the administration of drugs that sounds the same but have completely different purposes. A scenario like this happened to me when I mistakenly pulled out tramadol instead of trazodone, which was almost administered to my patient with metastatic testicular cancer. Tramadol is a narcotic prescribed to alleviate the pain caused by cancer, and trazodone helps with his major depression. I accidentally pulled out tramadol because it was right on top of trazodone in the list shown in the medication cabinet and thought it was one of the drugs that the nurse had told me to pull out. The nurse told me to pick up the speed and it made me kind of careless and disregard repeating the name of the drug to the nurse supervising me before I clicked on the medication tab and pulled it out of the cabinet. I found out I made an error because when I scanned the medications, it said in the computer that tramadol was not scheduled yet during that time. And when I told the nurse about it, she checked the paper where she listed all of the medications that was due and found out that we pulled out the wrong drug. We went back to the medication room and retrieved trazodone, which was the right drug that was due. Me and the nurse checked the mark to ensure that we all have the right drugs pulled out, provided education to the patient about each use, and administered it to them. The nurse and I discussed what went wrong, and to avoid this medication error from happening again, we enumerated 3 things. First, the student nurse should repeat at least 3 times the name of the drug to the preceptor, then a dose and route before pulling it out of the med cabinet. Second, always scan each drug to be given and ensure that it is due at the time of administration before opening it to avoid wasting drugs and to avoid having a hard time removing it from the rest of the medications in the cup. Lastly, if there are 2 drugs on the list that sound and spell close to the same, look at the mark or ask the preceptor to verify that drug being pulled is the same to verify that drug being pulled is the correct drug to avoid errors, maintain patient safety, and save time from the hassle of returning the wrong drug and pulling out the correct one.